Well, I've always been an occasional overweight child, but beginning in the 1960s, the average weight of children began increasing slowly. And then in 1980, that rate of increase dramatically accelerated. So that comparing to the 1960s, there are today 3 or 4 times as many overweight or obese children. In a certain sense, obesity is the ultimate holistic medical condition, really reflecting both our genes, our diet, of course, physical activity, but also emotions, psychology, family dynamics, the environment, even political considerations play a role. As, for example, the recent farm subsidies legislation. The government is spending billions of dollars into making very cheap foods like high fructose corn syrup even cheaper, whereas fruits and vegetables, inherently expensive, even more so. Obesity can affect virtually every organ system in a child's body. We've seen an epidemic increase in type 2 diabetes. This is the kind of diabetes that has always been seen, but associated with being overweight in adults. We're now seeing cases of type 2 diabetes in children as young as 8 or 10. In addition, areas of particular concern include fatty liver, a range of heart disease risk factors like high blood pressure, high cholesterol, asthma, musculoskeletal problems involving the legs, knees, hips, and back. And one other condition is noteworthy, and that is sleep apnea, which can make it very difficult for a child to get a good night's sleep, and leading to excessive sleepiness in the daytime, changes in hormones that can lead to increased hunger and further weight gain. So after 25 years of very bad news about childhood obesity prevalence, recent data suggests that the rates aren't increasing anymore. Though it's too soon to know whether this is a temporary lull in an ongoing epidemic or a true plateau. Even if it is a plateau, prevalence rates are so high that unless we see sustained reductions in prevalence, the toll of this epidemic will continue to mount. And that's because it can take many years for an obese child to develop complications like diabetes or fatty liver, and an additional number of years for those complications to translate into life-threatening problems. Genetics certainly plays an important role in determining which individuals are predisposed to weight gain in our current environment, some would call a toxic environment. But genes can't explain the rising prevalence of obesity among genetically stable populations. So to understand the epidemic of childhood obesity, we have to look to environmental causes. The changes in our diet, physical activity level, stress levels that involve everybody, including children, family dynamics, and the like. For adults, we use body mass index, which is sometimes abbreviated BMI, to define normal weight, overweight, and obese. For adults, a BMI of 25 to 30 is considered overweight, and a BMI over 30 is obese. For children, the relationship between height, weight, and body composition changes as a child grows and develops. So instead we use percentiles. Just as we would look at percentiles for height and weight, we can look at percentiles for BMI. So the 85th to the 95th percentile of BMI is considered overweight, and anything above the 95th percentile is considered obese. But this is a screening tool and will vary from child to child. It's possible for one individual to have a high BMI because of great physical fitness and extra muscle mass, and actually not have too much fat in the body and not be at risk for obesity-related complications. So BMI applies well across the population, but needs to be applied individually for each child. Ultimately, the word diet comes from the Latin meaning a way of life. So we like to think of a diet as not a short-term fix for a problem that involves deprivation and calorie counting, but instead an opportunity to establish a healthy way of eating that will lead to short-term weight loss, but ultimately long-term health. So in that sense, it's never too soon to be eating right. The Optimal Weight for Life program was founded in the mid-90s based on a multi-specialty model, recognizing that obesity is caused by many different factors. We have doctors, nurses, dietitians, psychologists, and social workers that all work to individualize a treatment program for a child in a family context. We operate under the principle that while we all need to be working to make the world a healthier place for all of us to live, the one environment that parents have complete control over is the home. So we work to support parents to improve the quality of foods in the home, access to physical activity, and most importantly, parenting practices that can transform conflict into cooperation.